Okay, I think we are live. So,
Yes.
hello everyone. I hope we are both of us are visible, and so and we are not only visible but also hearable to others.
Yeah.
So, I
Hello,
hope
good evening,
everyone is.
everyone.
So and you can just give your highs in the chat box. Uh, I'll be keeping a close eye on it. Uh, so yeah. So in the meanwhile, we'll just give ourselves a brief introduction on. Hello, Sonali Auntie. I was wondering who will be the first to comment.
Hello, Sonali.
So uh, I'll just start then. So hello
Sure.
everyone. Welcome to a very unique session on routine Blue Circle workshops online, where we normally conduct sessions every Sunday, but for the first time since we started this online workshops in 2020, this is the first session that we are hosting on a Saturday. It's the first time for everything, isn't it? So we have had over 250, more than 250 workshops on various topics regarding diabetes. So with regards to managing diabetes as a caregiver, as a as different sort of situation, and basically we have gone through, even with regards to diet management, exercise management, if you're going to the gym, what tips you should do during gym time and things like that. So so we have so today's session is on it's on that side of things, you could say, but instead of the physical side, we are talking about the mental side of managing diabetes. So my name is Madhur, as you can probably see from the screen, and joining me for this session on managing stress and diabetes is Dr. Kalpana Raval. I've got your surname right, because it's
Raval,
very
Raval.
difficult.
It's like Paresh Raval.
There you go. Dr. Raval has been uh, Dr. Raval. I think it's better that you give your introduction to the
Absolutely.
people watching.
Not a problem. I've been a practicing psychiatrist since almost now 25 years. Born and brought up in Pune, studied in BJ Medical College, and pursued my psychiatry training as well from Sassoon. And I have been in private practice since, like I said, almost 25 years. Makes me really feel old actually when I'm saying this. That it's so many years that I've been a psychiatrist. It's a hint to my age as well. So, anyways, but I'm really glad to be a part of this group and this session. I'd heard about Blue Circle from a friend of mine, and I've seen what difference this community has been making to her daughter. And I had always sort of shown my willingness to help in any which way I can. So glad to have this opportunity and glad to connect with you, Madhur and Nupur.
Thank you very much. Um, there are more people joining in the chat.
Sure.
Hello, Ravinder sir. Hello, Poonam auntie. How are you? And hello, Vipin Vipinish Shatmya. I hope I haven't butchered your name. If I have, I can apologize. I, I should apologize. I'm sorry about that. Um, if you have any questions with regards to today's session, then please do not hesitate in putting it in the chat. So without any further ado, we'll just start with the basics of the mental side of diabetes. So, from a patient's perspective, diabetes, I would say, is not only a physical condition, but it's a mental condition as well. Um, with regard, I mean, not only because we have to keep thinking about the at least in 2 to 3 hours in advance with regard to the
Yeah.
meal we are having. So if you are having, say, some exercise done or anything, if you're say going to have something to eat outside, even after having some dinner, for example, like I sometimes do. So we have to think in advance that how much insulin we need to take, how much carbs you're having. And it's quite a mental battle because you have to do the maths in your head. There are applications which can do the help for you, but most of the time they're not that accurate. And not and even with kids these days, their parents do all the mathematics for them, so it's another burden that they feel like should be something that can be reduced, for example, if I say so. So I mean, it is something that needs to be thought about. So the stress that all these number crunching things about uh, what to think about when you get low. I hope, God forbid, we
Yeah.
can't should not get that many lows.
Yeah.
What to do when we are going high and things like that. So it is a and also with regards to with nowadays with college life, with school life, with work life, with family life, even for people
Yeah.
for diabetics who have families. So it is a mental, like we say that a mental gymnastics. It is so accurate for managing diabetes. So
Yeah.
uh, there are there are a few topics which I feel like we should go through in this session. So without further
Absolutely.
ado, if you're fine, should get going then.
Absolutely. Absolutely.
So I the first point I wanted to ask you was whether stress affects blood sugar levels with basically for people for diabetics. So what are your thoughts on this?
Not just diabetics. I think let's first understand that it affects blood sugar levels for even normal people. The difference between how that poses a challenge is definitely different for normal people, so to say, non-diabetic people and diabetic people. Um, I was, while you were narrating the initial sort of picture of having type 1 diabetes and how it is a mental gymnastics, what sort of came into my mind was, as a doctor, I know what kind of machinery is there inside. And I was just wondering that it's so unnoticeable when the whole orchestration is perfect. It's almost like a flight on autopilot mode. You don't even notice a bump. Everything that comes along is dealt with without your conscious brain being applied to it. And that is why many a times we don't even realize the stresses that we have. Where not that we don't have stresses, but we don't realize them because the autopilot is working fine. Just because one component of this whole orchestration is not working, it poses so many extra challenges for especially the type 1 diabetics. And before beginning the session, I was just talking to Madhur, and I said, even for type 2 diabetes and type 1 diabetes, there is a difference. Type 1 diabetes poses extra challenges. Now, of course, that is a lot of work, and you can imagine it to be similar to um, flying a plane in the ancient era when everything was mechanized, when everything was done by the pilot. He would be struggling so much with all inputs and with all actions as outputs. And it wasn't an easy journey for a pilot. So, similarly, for type 1 diabetics, it's definitely not an easy journey, and that's a big, big, big thing to accept, admit, and then work on. Now, um, where the question began, whether stress affects the blood sugar level or not. The Like I said, stress affects blood sugar levels of each and every individual. It's basically a siren that goes off, whatever we call as stress. Stress is basically brain signaling all the parts of the body that we are probably entering a war zone, or we are probably having a survival mode turned on, and this is an emergency, and everybody gear up for combating this emergency. So the first thing that the body needs to ensure during emergency is good adequate supply of energy, and glucose being the easiest energy to be consumed by all parts of the body. Obviously there is a rush of glucose in the bloodstream. So we all have raised blood sugar levels when we are stressed. The difference comes in the picture where non-diabetic people will realize that there is high glucose level and release insulin to kind of control it on their own as a automatic backed up mechanism. Whereas for diabetic, type 1 diabetic people, because there are no resources having insulin inside the body, it becomes more of a conscious action. And that is why this becomes additionally stressful. That, oh,
Okay.
my sugar level has gone up, I need to do something about it. So, and I also realize, I mean, one would get symptoms as soon as the sugar levels go beyond a point. But stress increases sugar level of all. How to manage it is something that I think you all know better than probably even so called normal people.
So that is very, that's, I wouldn't have even thought about these kind of things from normal patient's perspective. So thank you for that. So the next question I've got is with regards to it's more hormonal related rather than just the mental, the brain being uh, it's just not linked to the brain at all. So the my question
No, no,
is
I
there any
think
link between? Yeah, please. Sorry.
Absolutely. In fact, there is a very, very well documented and highly researched link that we talk about in our fields these days, and that is what we call as PNIE axis. That is psycho, neuro, immuno, endocrinal pathway. Uh, when I'm talking about these four headings, let me give their meanings. Psycho means mind, neuro means brain and brain function, the normal calculative organizing brain function. Immunological means are obviously immunity, and endocrine means all the hormonal systems, right from thyroid to steroids, cortisol, as it is very, very famous, to digestive
Yeah.
hormones, to reproductive hormones, and so many other endocrine elements that we know of. So, this is the core engine of our body, and they are very, very closely linked and mostly regulated um, together, as in as they share their boss in a way, and they have high impact on each other. So anything going wrong in one of the departments is likely to produce some effect in the other department. So anything wrong with the hormonal system will have impact on digestive immune system, nervous functioning, that is brain functioning, and the emotional well-being. Anything wrong with the brain will again have effect on the other three. And so stress, as we feel, the psychological element or mental health stress will definitely have its impact on the rest of the three components. I would like to take a moment to clarify one thing here, though, that what generally is spoken of stress is mostly stress here, as in the mental stress. But as a doctor, we actually define stress as any change in the internal or external environment of the particular person. So even daily little things can actually be a stress for the brain. Like, for example, change in the temperature outside, changing duration of sunlight, or having not drunk water for a long time, or having not having food for a long time, or just being extremely active on some days, having fever, having infections, anything and everything, having less sleep. So, actually speaking, stress is all that, all those factors which require the brain to adapt. And sometimes people say that, oh, I don't have any stress, I'm okay. But then, even small little things will be there and they will pose as stress. ठीक है?
Yeah.
So here with type 1 diabetes, now the axis that I told, there is one basic link missing. The insulin is missing. And as a result, forget about the external stresses, forget about the internal infections or dehydration or anything. There is one constant stress for the brain, that the insulin is missing, how to make the glucose available. So, whether or
Okay.
not one thinks about it, the brain is actually definitely stressed.
Okay.
Secondly, there are kind of, because of this axis, there is more vulnerability generally. Even if there are no troubles in the management of diabetes, generally there is a link between type 1 diabetes and anxiety and depression. And that again poses different challenges, because then it becomes even a difficult task given your vulnerability. And then on top of that, like Madhur was describing earlier, planning for everything, calculating everything, counting everything, and doing all that math, especially at the age where type 1 diabetes affects the most. That's the very, very young age, when you don't even have developed the capacity to do all these complex mathematical calculations, is definitely, definitely a big stress.
Okay. Actually, there was a bit of a bit of a comedy incident which happened just now. As you
Yeah,
were
yeah,
as you were mentioning about drinking water or something, I just had a bottle of water. I just had a small sip of water, and everyone in the comments just going mad, just laughing about it.
but
But
it's a good thing. Yeah,
yeah, absolutely, absolutely. Uh, Before we move on to the actually, there are some questions in the comment section. I'll just read some out.
yeah.
Puneet Kataria has a question for us, for you, that
Mhm.
there is the T1D management related stress.
Yeah.
Obviously, there is. But
Hmm.
I am interested in knowing the emotional highs and lows that go along with changes in blood glucose. He has given two specific cases. Firstly,
Yeah.
frustration, anger associated with lows, and
Hmm.
second is pessimism associated with long term, that is 5 to 10 hour plus high sugars. So, what would you say to this?
That's a wonderful observation that you have made, Puneet. And definitely the sugar levels will keep changing depending on the emotional state, because the emotional state that triggers different responses, different hormonal responses will have their own coinciding changes on the sugar level. Mostly what we see is during any, like I described, the stress situation where the cortisol, or as it is called as a stress hormone, is released, the sugar spike is going to be high. But when you are mentioning about frustration and anger, it's more likely that it is consuming a lot of that sugar, stopping the blood sugar from rising, which is resulting in lows. Having said that, the depressive symptoms and what we call as chronic stress is always associated with slightly higher blood sugar levels. The stability is not attained as well when you are having anxiety features, depressive features, constant thinking, overthinking, worrying, and you're struggling. At that time, the sugar level is likely to be on the higher side.
Okay. There's another question in the chat box. Ravinder sir asks, is mental
Yeah.
tension and mental stress one and the same thing?
Well, it's how you call it. Mental tension and mental stress. It's basically, if you understand the physiology, like I earlier described, that any strain on your brain or on your system to adapt is actually a stress. What we describe as stress is the stress response by the body. Whenever there is a demand from the situation, we adapt, and that adaptation is called as the stress response. It's how, so every little thing, like I said, is a stress if it requires adaptation. It does not necessarily mean that I need to be bankrupt to get stressed about it. Okay, so mental stress, mental tension. Tension is a very commonly used word in the local language. So, yes, mental stress and mental tension can be considered the same.
Okay. Actually, regarding Puneet's question, he has a small comment to add.
Yeah.
He said to clarify, he's talking about reverse changes in emotion due to blood sugar
Yeah.
changes, which are
That
due
is
to
that
over
is
insulin or
also,
over carbon.
yes, that is also very likely. Again, that's because of this axis that I spoke of. It's the psychoneuroendocrine immunological axis. Anything and everything will have its effect, counter effect on the other system. So it becomes a cyclical thing more than just a one way, one directional effect. And so changes in emotions are also likely to occur when there are changes in the blood sugar level. When the blood sugar levels are high, you're likely to feel a little low, because what do blood sugar levels which are high mean? That the sugar is not available for use because of the lack of insulin by the body tissues. And so they are kind of depleted in energy. I'm not a diabetes expert, so I won't be able to go too much in details about it. But as a result of high sugar levels, it's likely that you experience a little bit of dullness. There are a lot of other factors as well.
So, adding to what Puneet mentioned, I had a question regarding that as well.
Hmm.
Because we do we do see cases of what you can say mood swings, which I
Yes.
have gone through personally myself. Because when where your sugars are low, you get very angry, or even when during high sugars, like you mentioned, we feel dull. So how can we calm ourselves in these situations, considering the brain basically just has no control over what you're currently doing? Because there
Correct.
have been few instances where even me personally, having gone through a bit of a low in the morning and had a bit of an argument with my mother for no apparent reason, which I feel like I shouldn't have had it.
Yeah.
And because of the fact my sugars were low, I got very angry on her, and I had to later on apologize to her because of the fact that I had a bit of a mood swing. It just came out randomly. I had to apologize while I was going to the office. So with regards to that, how would you say that we should calm ourselves?
Yeah. So when we talk about any physical disorder, physiological disorder, and the mental health and the stress arising out of it, I personally feel that there are the one thing that Madhur just pointed out, which I will take reference of, that sugar level is something that is beyond our control, immediate control. Correct? It'll happen uh, over a period of time, and it'll require some actions, as taking the insulin in additional dose, or eating something if the sugar is low or something. But that will still take time. That will require specific working of the problem. But where we are concerned about the mood swings, where we are concerned about the ups and downs that keep happening in the sugar level as a result or as a precursor to mood swings, I think what we need to focus more on is, rather than focusing on one high and one low, how can I maintain more or less a stable um, graph of my sugars? Because working on highs and lows will take away the focus from the long term effect of diabetes on mental health and mental health on diabetes. It will be just working for the problem. That can definitely be done with the help of your diabetologist. They are definitely more expert in doing that. But as a mental health professional, I think if we look at reducing the stress level generally and reducing the ups and downs, the frequency of them, the amplitude of them, and the effect, secondary effect that they may have on your emotional well being, then that is definitely going to help. Now, how to do that? Well, the quickest and the easiest method that can help you calm down in such situations is the breathing work. Most of the times we forget to do it or it doesn't come to our mind. But whenever we feel that something is amiss, I'm not feeling okay, trying to, one, look at whether it is a low, whether it is a high. That is one thing. Trying to still do a very, very, um, I would say, relaxing breathing technique. It can be from any school of meditation or scientific background, but what we usually see helpful is the Anulom Vilom Pranayam, which is the alternate nostril breathing, or something that people nowadays call as box breathing, which is like inhale for a particular number of seconds, hold the breath for the same number of seconds, exhale over the same number of seconds, and again hold the breath for same number of seconds. So breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and again hold for 4 seconds. This can be 3-second box, this can be 4-second box, this can be 5-second box, depending on how comfortable you are, how you practice this. But this is one thing that can help. The third thing, which again is found helpful, is a different type of deep breathing or relaxed breathing, and that is sometimes called as 4-7-8 breathing, but what I call as a sort of shorter inhalation, holding the breath, and longer exhalation. So you breathe in, hold, and then exhale as slowly as you can. I personally think it is easier to exhale through the mouth, like if, as if you are slowly blowing the candle or through a pipe. So breathe in through the nostrils, hold, and breathe out through the mouth. That breathing through the mouth actually makes it easier to exhale slowly. Otherwise, through the nose, sometimes we are kind of becoming more and more restless, or sometimes it feels a bit like choking. We are not able to control it as best as we can control the breathing out through the mouth. So, basically, breathing work is something that can be very, very handy to calm yourself down. Second is, sorry, the fourth breathing I will again mention here itself. There is something called as a belly breathing, diaphragmatic breathing, or abdominal breathing. Usually we breathe through the chest and less through the stomach, as in the belly. But when we are actually wanting to calm down, and the diaphragmatic breathing is to be done, usually what we do is breathe like as if you're blowing the balloon
Hmm.
of your tummy and breathe out. So it's more of the tummy blowing in and out, not like this. Your chest should be more or less stable. You can put one hand here on the chest like this to notice how much of it is moving. The other hand on the tummy. I'm sorry, I can't show you here, but I'll share a video of it later on, a link with it. And then you just focus on your hand on the tummy moving out and in more than your hand on the chest. So, diaphragmatic breathing is also helpful to reduce stress. The reason why all these reduce stress is because they strengthen what we call as the braking system of the body, which is technically parasympathetic system, which is like repairing system, which is like rejuvenating system, a relaxing system of the body. And these are handy techniques that can be done anywhere, anytime, by anyone. They don't require specific training. So this is probably your go-to technique in the events of stress.
Okay. So there is a very interesting question from a parent of a diabetic. I'll just
Yeah.
quickly, tell you, ask you.
Yeah.
It's very stressful for parents also. I kind of basically I have seen
I completely agree.
from my parents' side.
True.
Right now, my son is 8, and
Hmm.
so for him, he just sees that we stop him from eating something.
Hmm.
We so in pregnancy course we need to plan like how I mentioned, okay,
Yeah.
or playing for hours and hours like kids usually do, because we
Yeah.
understand the repercussions that's why we carry the stress in on his behalf. We don't want to
Yeah.
transfer this stress to our son as he grows up and eventually learns to manage independently. How do we deal with this? In addition, she has mentioned frustration and anger are two things we have observed on our son from time to time also, mostly when sugars are higher. So what would you say
Yeah.
to this?
More than only when the sugars are higher, I'll again, I think someone else had also talked about frustration and anger. And I think it is not just when the sugars are high, but generally when the diagnosis is shared with the person. Obviously, in type 1 diabetes, one cannot hide it. From however young the child may be, one cannot hide it. And that is a bit of a shock. And the emotional reaction for any kind of shock or loss, as we see through the psychological adaptation to it, is that it will go in all these through all these stages of firstly being in denial. That happens more with the parents, I think, than the children. But denial, anger, bargain, depression, and acceptance, the dabda model as we call it, is usually what we see as emotional reaction to any event, such life changing event in life and any loss in life. So frustration and anger are arising out of this very difficult crunchy situation. It's a pressure cooker situation, which I explain as that whenever there is so much pressure going on, somewhere or the other that whistle is going to blow. And if you look at it like that, sometimes it is also okay to let that whistle blow. So, not every bout of frustration and anger needs to be stopped or needs to be uh, reacted to in a way. Yes, it needs to be responded to, but not reacted to. Frustration is arising out of this inability to lead a normal life, which is absolutely understandable. And saying that it is okay to feel frustrated actually will give the kid a little more freedom to express. So, remember this particular frustration and anger as the whistle given by a pressure cooker, and allow it sometimes moderately. Second is, as a response to it, as a parent, um, I think it is also necessary to be as honest as possible, which again is what I tend to suggest to many of my clients, that you can discuss about your difficulties as well. That I understand your frustration, but I am frustrated too. Let's both try and find a solution to it. There shouldn't be a sort of, I mean, one shouldn't hesitate to admit that you as a parent is struggling too. Yes, while saying that, you don't get it out as if it is an angry outburst or as if it is a frustration on your own child. But you say it as really a tricky situation that even you are trying to learn about. It's almost like a math question which your son may get to you that mama, मुझे ये sum आ नहीं रहा है, can you help me solve it? And probably you also don't know how to solve it, and you would say कि even I can't solve it, let's go and ask the teacher. If you look at these problems or these frustrating moments in a similar way as a parent, I think it will ease off the pressure from your brains, your minds. That will also help the child feel more at ease. And if I'm not wrong, the episodes of frustration and anger will start reducing. The second thing is, again, making a story which is relatable for the kids about how type 1 affects them and why are there so many restrictions. And if you are able to do that with the help of your endocrinologist, with the help of your diabetologist, it will become easier for the child to regain control on his or her own behavior. Again, rather than just saying, no, you can't eat this sweet, it is better to either find a substitute and explain that this will be better than this. And why? Because the insulin is lacking, but in a way that the child understands. That will help the child not feel frustrated, that will help you not feel helpless. And as a result, I think it will also improve the communication between all the family members.
Okay. I hope, I think this was Akanksha's question. I hope this has answered it for you. Uh, on I have got a few questions. So
Yeah,
I mean, there are a few regarding with regards to parents asking about their kids. But I this is something that even they can ask on the child's behalf as well. I think we have already mentioned about this, but uh, something that even I went through as a that the phase that I
yeah,
went through, uh, called stress eating or
yeah,
stress binging, about
correct.
basically eating too
Yeah,
much at a time when
true.
you shouldn't eat a lot.
Yeah,
So about being stressed about hypers,
yeah.
how does anyone avoid this kind of situation happening? uh, Basically, how can we plan to avoid these kind of things happening?
Correct, correct. But let me again say this outright that it's not a problem just for type 1 diabetes affected people, but it's for everyone. There are so
Yes,
many
it is.
people who would have these binges of stress eating, comfort eating, or binge eating whenever being emotionally upset. And that that is probably the natural urge by the body to feel good, to make it feel good, to have the dopamine release, and to sort of have the positive emotions rushing back in the brain again. So it is a very, very reflex kind of action which the brain at a very basic level will suggest anyone. One will feel the craving for something sweet, something which is cheesy or comforting, which is chocolatey, which is really a soulful meal. Now, what one needs to learn how to prevent it from hampering the sugar levels is keep a few snacks ready for such urges when you want to binge. This is a case similar to even people who are going on a weight loss journey. And there was a time in our life
I am one
when
of them. Just to interrupt, I am one of them.
I have been one of them, so there's no hesitation in admitting it has taken a lot of effort to sort of finally come closer to my baseline, although it is not yet medically okay. But it's been a struggle for a long, long, long time. But I remember when we were seriously looking at our diets and our cravings and our comfort food, we have resorted to some strategies as a family. And I think these are helpful generally to ensure a better health and to ensure that you don't have these sugar ups and downs. So, having no snacks in the house which are going to be bad, like for example, when we started our weight loss journey, we stopped buying biscuits and khari and bakery products as a family, and everyone supported, as in my mother-in-law, husband, myself, everybody, my brother-in-law and his wife, we sort of stay together. So we all gave up biscuits and khari and bakery products, and we hardly purchase any of these in the house. So having no temptations was one of the sort of techniques that helped. Secondly, having better alternatives for snacking also helped. Like, for example, having roasted chana, roasted singdana. I used to have frozen bananas in my deep freezer, which satiated me as if I was eating ice cream. They are a wonderful snack to go to when you are, if you have frozen fruits, just a little portion of it can help your mouth feel nice, brain feel good, but at the same time, because of the fiber content and no additional sugar, the refined sugar added to it, it can be helpful. You can also resort to curds, milk, if one is fond of them. You can discuss about such different options. Fruit yogurts without any added sugar can be a good thing, and frozen yogurts. Ice creams are likable, lovable, but if they are done in the proper way, like frozen fruits, sorbets, or frozen yogurts, I think should be okay as a snack during these times. So one can discuss with the nutritionist, one can discuss with the doctor what all is allowed and keep it handy, ready in the freezer, in the fridge, in the cabinet, and go to it. That will help not feel guilty about this comfort eating. Although it happens
Okay.
and it can happen occasionally, it will not affect you adversely as far as your sugars are concerned.
Okay. Uh, so, I
The
mean,
second thing,
there
sorry,
are. Oh,
so,
sorry.
yeah, just one additional thing. Um, there was another thing which we used to follow, and whenever one feels like eating for the comfort, drinking nice chilled water or a very patla wala buttermilk can be good options, or eating cucumber salad, something like that can be a good option. If you have had food very very recently and you know that you have stuffed yourself well, if you are sure of that, you can actually distract yourself from this hunger or this craving or urge by being physically active. Just going for a little jog or doing a few jumping jacks in the place or going up and down the stairs can be again good distracting techniques. They also help in another way because physical activity will generate a little more energy, bursts of adrenaline, which will again help you feel better, and at the same time which will make this sugar balance easier.
Uh, okay. So, final few points. Firstly, there have been instances that, I mean, I have noticed. I'm not too sure whether the others have as well, with regards to sleep disruption
Yeah.
and their effect of on sugar levels, with because of the fact that the day has been so stressful. You haven't been able to reduce basically reduce that stress, and so because of that, have you what can be done if this situation occurs with regards to sleep
There's a
disruption and
generally,
sugar level?
again, generally to ensure a good night's sleep, what we suggest on a first aid level is something called as sleep hygiene. And there are a few things
Okay.
which we can ensure and help us to fall asleep in a better way. Although as type 1s, you may have to wake up in the middle of the night to sometimes check the sugar level, or you may have some symptoms during the middle of the night. But still, whatever sleep you get, if it is of a good quality, it will not have a disastrous effect on the sugar level. So, some of the points, again, I'll share a small YouTube video for the sleep hygiene, some tips to ensure a good sleep, good night sleep later with Madhur, and so with all of you. But a few things of that is, um, during the night, before your sleeping time, it is best that you switch from white light to yellow light. That is one of the tricks that helps your brain to understand that this is not a sunlight anymore. The day has ended and now it is the night time. Switch to dimmer light settings after say around 9 9:30 or so. Secondly, um, having no gadgets for at least half an hour or 1 hour before your sleeping time. Maybe you can go back to listening to music and playing some games with children, especially if they are not having any studies, nothing pressing. Parents can even play games like snakes and ladders and ludo and cards and carom with children, maybe half an hour, 1 hour before sleeping time, while listening to a nice soothing music in the background. Reading a paperback, um, not the Kindle or not a screen, basically, can be a good option. And one more thing which I mentioned about earlier, and I'll again mention it here because it has a really, really good um, help for ensuring good sleep, and that is progressive muscle relaxation technique. This is a scientific technique based on meditative practices, but it is easy to do. It is about 20 minutes long, but you gradually, sequentially do contractions and relaxations of your body muscles, gently breathing through the way. And whilst doing this, many people have noticed that they fall asleep halfway through. So, this is another good technique that one can help fall for falling asleep. Now, even if something wakes you up in the middle of the night, the quality of sleep, if it has been good, it will not hamper your sugar levels as much as your restless sleep or restless night might have. Okay, so I'll share some of the links with Madhur and Nupur later on, which you all can take help from, and I'm sure you will have better sleep in the coming days.
Absolutely. Uh, we are now into the final 10 minutes. So
Yeah,
before we move on to the final few points, if there are any other questions in the chat, for the people watching this session, please don't hesitate in putting it in the chat box. Final question, a few questions. I'll just combine three questions
sure,
I had into one.
sure.
Firstly, would you recommend, if in situations where uh, these techniques are not helping in,
Yeah,
for some reason, it can happen, I'm not saying it cannot happen at all,
yeah.
would you recommend therapy, coaching, or any group support for that?
Absolutely,
and
absolutely.
and in addition to that, it also, can you any therapy approaches, and along with that, how can your friends and the friends around you and your family members help to reducing stress? I mean, we have discussed about how families can basically help to manage stress together, but how
See,
can
it's
your friends can help?
again. I will again put this as um, In similar line to many other illnesses that as a psychiatrist I come across. So type 1 diabetes definitely is a big challenge, but so are many other medical conditions, so are many other psychological conditions. And firstly, trying to remember that this is just one little part of your life is very important. When you feel a little frustrated, when you feel a little stressed, um, you have to remind yourself that this is just one little part of my life. This is not my whole life. Sugar control is the only problem. Your brain, your physical activities, your heart, your breathing, your other skill sets, creativity are still, although affected and although linked with the sugar level, it is still a different ability or potential that you have, and that needs focus as well. So let it not over occupy the life of the person as well as the family. That is one. Secondly, if all these first aid helps don't help, there shouldn't be a hesitation in seeking professional help. I would say that therapy helps. Community like yours, the Blue Circle community, definitely has been helpful. But even for that matter, um, going consulting to a psychiatrist, even for some days, taking medicines for the difficulties that you are being posed with, is all right. There shouldn't be It shouldn't be equated to your strength or your weakness. I was just telling one patient in the afternoon itself that this shouldn't look like or feel like you being weak, so you needing medicine. And I gave her an example which I would like to give here, that when you are having a viral infection, the actual attacking agent is a virus. And the actual treatment, theoretically speaking, logically speaking, should be an antiviral medicine. But for normal flu, which is also a viral infection, what do we take as medicine? We take paracetamol to get the fever down. The fever is actually body's response to virus. It's not the actual reason that we are taking the treatment for. But we contain the reaction, bring it under control so that our body's immune system is able to contain that virus, which in the outset started this whole reaction. Now, in a similar way, the main problem is blood sugar level. But if the emotional reaction is going out of hand, it is possible to contain that emotional reaction, which is again going to have a vicious cycle effect on the sugar level. So, contain it with the help of medicines and then allow you to deal with whether there are emotional um, challenges, or whether it is just sugar level, or whether it is acceptance or the depression, anxiety, in your own way. So there shouldn't be a thought in the brain which tells you not to go to a psychiatrist because I'm not weak, I'm strong enough. No, it is not about your strength and your weakness. It is about the situation, whether it is going out of control or whether it is within the manageable limits. And so, um, try self help first. If not, I mean, along with the community support, the peer group support, the group therapy sessions, talking it with friends, family, and everyone around you. But if that doesn't help, go for the professional help, either in the form of a psychologist's help, or I would say go to a psychiatrist. Don't hesitate. Not all psychiatrists will prescribe all the time, and depending on the need, one can decide the further plan of action.
All right. On this very positive note, I would like to thank Dr. Kalpana Raval, sorry again,
No, no, it's all right. It's all right.
for coming today. Thank you
It's
all
my
for
pleasure
joining us.
and my honor to do something of this kind. And I'm really, really happy to have connected with you and the Blue Circle for it. And hope this has been helpful.
Definitely.
I'll definitely share the links that I just mentioned. And please feel free to get benefited from that.
So yes, definitely. And before we go, I would definitely let everyone know that we are on every single social media network. Facebook, the group name is in the box below. On Twitter or X, whichever way you want to call it, Instagram, LinkedIn, YouTube, and even blogs. So we have got meetups everywhere, in every major city in India: Pune, Mumbai, Delhi, Nagpur, Ahmedabad, Bengaluru, in pretty much every single major city in India. So you can come. We host monthly coffee meetups or runs or games nights or different social activities for newly diagnosed diabetics to join. So the next episode of this will be on a Sunday. I'm sure of that. So I think the next session on Sunday coming up is basically transitioning type 1 diabetes care from parents to children. So I hope you join for that session. And from me and from Dr. Raval, it's have a lovely evening and see you soon.
Bye bye.
Bye bye.